Hello, Nurse Practitioner, Functional Nutrition and Fitness Coach Nicole here to talk to you about GLP-1 drugs for weight loss, which is the latest trend in weight loss drugs. Now, as always, these videos are for information purposes only and are not meant to diagnose or treat any one person. You must seek the help of a qualified health professional for your individual healthcare needs. Obesity is a growing concern in the U.S. According to the CDC, from 1999 through 2000 and then through 2017 through March of 2020, U.S. obesity prevalence increased from 30.5% to 41.9%. During that same time, the prevalence of severe obesity increased from 4.7% to 9.2%. Obesity-related conditions include heart disease, stroke, type 2 diabetes, and certain types of cancer. These are among the leading causes of preventable premature death. There are currently 6 FDA-approved drugs for weight loss, 2 of which are GLP-1 drugs, semaglutide and liraglutide. GLP-1 drugs come as subcutaneous injections and were developed to treat type 2 diabetes. While GLP-1 drugs have the side effect of weight loss, many are still not yet FDA approved to use just for weight loss alone without underlying type 2 diabetes, meaning the use of these for weight loss is considered off-label and is not covered by insurance. GLP-1 stands for glucagon-like peptide, which is a hormone that is released from the gut when eating that starts the signaling pathway for insulin release. It also starts the signaling for fullness or satiety, so you stop eating when full and satisfied with the meal. GLP-1 is one of the first hormones to downregulate in obesity and worsens as the obesity worsens, and even more so when insulin resistance and type 2 diabetes begin to develop. GLP-1 agonists, such as the new drugs now available on the market, help to upregulate GLP-1 to improve insulin sensitivity. They also help with appetite suppression, which is how they help with weight loss. The person eats less because they have less of an appetite. These drugs include dulaglutide or Trulicity, which is every week, exenatide extended release, which you use weekly, or regular one, which is twice a day, semaglutide, also known as Ozempic, which is weekly, and liraglutide, also known as Victoza, which is daily. On average, study subjects lost 10 to 15 pounds on these medications. So are these the magic bullets that we have been waiting for to cure obesity? First off, without proper lifestyle interventions such as diet and exercise, just as with most any medication for chronic disease, benefits are limited and temporary. In a long-term study of participants that used semaglutide weekly for 68 weeks for weight loss, 1 year after being taken off the drug, the weight regained was 2/3 of the prior weight loss. Too often, a patient will be given a prescription for medication with vague dietary and lifestyle advice, if any at all. There is a lack of proper education for providers to give out this advice and a lack of time in a typical provider visit for this education to be done. There is also a lack of adequate follow-up with patients and accountability. Writing a script is easy and quick, but it does not fully treat the patient, and it's not true healthcare. I have worked with clients who came to me already taking a weight loss drug, such as phentermine or a GLP-1 agonist. While they had some success with these drugs, they were still struggling with diet and exercise habits to get them to their ultimate goals and stay there. And then when coming off these drugs, staying on them long term increases the risk of side effects and can be prohibitively expensive, especially with GLP-1 drugs. There is a rebound that these clients experience where their weight will bounce back up and their appetite is worsened. This is very frustrating for them as they feel that all the work they have done is gone, which is not true. We just have to keep moving forward and regain ground to continue working towards their final goals. Thankfully, I have been able to work with these clients and help them get back on track to their goals, even after coming off these drugs. We live in a culture of immediate gratification, and drugs have been part of this. While we have life-saving drugs that have done amazing things, they are not the magic pills for every ailment, especially for chronic diseases of lifestyle such as obesity. If you are interested in using a medication to help with your weight loss, especially if your BMI is over 35, you have insulin resistance, type 2 diabetes, heart disease, high blood pressure, or sleep apnea related to your weight, talk with your PCP about your options. These drugs might be right for some people for a short time to help kickstart their journey and improve health markers. But also make sure you work with a qualified health professional, such as me, on the other 75% of the equation, your diet, exercise, and your lifestyle. This is how sustained change is made, with a total lifestyle overhaul done systematically and over time. I know, it's not as sexy, but it's what works. If you would like to see how I can help you on your weight loss journey, contact me and we can get a free consult set up. If you like this video and found it helpful, please like, comment, share, subscribe, or follow for more. Be your own advocate and take charge of your health.